In this video, I will discuss the negative impacts on an organization when its members use power and play political games within Mintzberg's political game playing framework. According to our textbook, Healthcare Management Theory and Action, there are two main sources of power, social power and structural power. French and Raven's model describes the 5 sources of social power typically seen in organizations: coercive, legitimate, referent, expert, and reward power. The 5 sources of social power are defined in relation to an agent, who is trying to cause change, and the recipient, who is influenced by the power to change their behavior. Coercive power is based on threats. Coercive power is enabled by the agent's span of influence and how much the recipient believes that their compliance will avoid punishment. Coercive power occurs when the agent threatens punishment if the recipient does not follow the agent's instructions. Legitimate power is based on respect. Legitimate power comes from the agent's position within the organizational hierarchy and how loyal the dependent is to the agent. Referent power results from the agent's personality and is based on respect and the recipient's personal desire to please the agent. Expert power is based on the agent's knowledge and results from how knowledgeable the dependent believes the agent is. Reward power is based on a reward or recognition that results from compliance. A person can be encouraged to change their behavior in exchange for a reward or recognition. There are 3 structural power sources in organizations: resource, decision, and information power. They are all based on the organizational hierarchy. Resource power is dependent on the number of resources that an individual leader can access. A director has more resource power than a manager. Decision power is based on an individual's authority to make decisions. A physician can make treatment decisions while a nurse cannot. Information power comes from having access to valuable information that is not readily obtained. These social and structural powers can be used together to improve organizational performance. An effective manager can improve organizational performance by influencing the goals of his employees to align with those of the organization. If employees have goals that differ from those of the organization, they may begin to play games that serve their own interests. Mintzberg's political game playing framework describes how players, internal and external to the organization, may try to control the organization's decisions and actions. Mintzberg describes 13 games, but I have chosen to elaborate on alliance building, insurgency, and counterinsurgency. Alliance building describes when leaders use their peer networks to increase their power. This occurred this year when Dignity Health merged with Catholic Health Initiatives to form Common Spirit Health. Both hospitals have their own reasons for forming an alliance, but they both likely felt increased government and market pressures to provide enhanced quality of care and increased access at a lower cost. 2 downsides to a merger are that the organizations may experience less operational autonomy due to their level of investment and risk compared to the other. And organizations are often restructured after a merger, so employees may lose their jobs. Insurgency describes individuals or groups that confront authority. Counterinsurgency is when leaders defend against an insurgency. Insurgency and counterinsurgency were exemplified when our union contract was up for renegotiation this year. It was a 3-month ordeal with my peers and our union on one side, and lawyers, a regional manager, HR, labor relations, the CFO, and the COO on the other side. The hospital proposed a set of wages, and we rejected it. We proposed a set of wages, and the hospital rejected it. After 2 months of negotiations, we began informational picketing at all 6 of our hospital locations and threatened to strike. When the hospital realized that they couldn't get any traveler clinical laboratory scientists to replace us, they returned to the bargaining table with a more desirable offer. While the CLSs were guaranteed a new wage scale, this causes some negative impacts on the organization. The higher CLS wages cut into the hospital's budget, so budget restructuring will need to happen to make up for money lost, and there is a future possibility of combining positions and laying people off. Though unions do function as a bargaining unit and provide support during grievance processes, they are also a business with motives that may differ from its members. Unions may bring their own political and social agendas into the healthcare facility. They also seek to organize other hospitals because the more members they have, the more revenue they make through dues. Nursing unions, in particular, have a number one concern that is even above wages and benefits: patient care. Patient care is often directly related to nurses' working conditions because they are the ones tending to patients on a daily basis. In terms of my occupation, our resources and working conditions dictate how quickly we can process a specimen and release the results to physicians and nurses, who can't make treatment decisions without lab results. Collective bargaining only works when both sides compromise. In our most recent contract negotiations, we got the higher wages that we asked for, but it increased the cost of family medical benefits and reduced the coverage for pharmaceuticals. As future healthcare leaders, we need to remember that successful negotiations and relationships between unions and employers are based on mutual respect.